Hello, this is Bill from Mission Veterinary Clinic, and I would like to talk to you about communication within the hospital and using the callback feature. Um, so let's just jump right into it and let me do a demonstration on the callback feature. First, I'm going to start by going up to the upper left-hand corner, the second icon there, and I'm going to open a client. I am going to open William and Dana O'Leary as a patient. They are client number 3, tab. And then I am going to use test 5, which is one of their pets, as an example. So let's go give a for instance. Let's say a client calls, the client William O'Leary calls and wants to leave a message for Jane. Calls up and Jane is not available and wants to know what groomer Jane is using. You could go to test 5, click on test 5 so it's in blue. Then go down to the third icon in, which is a yellow orangish bell, and it says reminders. I'm going to click on that reminders bell. Now, within this item ID and description box here below, I can right click and click update, or I can double click and this box here will open. Now, if you go to this box, you'll see the callbacks tab. I can click on the callbacks and in the item ID, type in CBAC for callback. I'm going to tab. I'm going to put in a date that I want Jane to call this client back, probably the next day she works. Okay, so we'll put in tomorrow, the 25th. And then now I need to put in Jane's staff ID, and I don't know what that is. So I'm going to double click on Jane's name. This box here opens. I can scroll down to the bottom until I find her ID, and I see it's 188. Double click on her name, and then I'm going to click Open. I enter my staff ID, and I type a note for Jane. And this note is going to say, Mr. O'Leary called and wants to know what is the name of the groomer you recommended. And I'm going to go over here to spell check, and it looks good. I'm going to change the status from open to pending. If I leave it as open, anyone can delete it. But if I leave it as pending, it doesn't have a choice. It has to be completed. So our choices are open, pending, and completed. I'm going to put it at pending. Then I'm going to click OK. I'm going to come over here, and I'm going to click OK. Now, there's going to be some new protocols. Every employee, when they come to work from now on, a couple of times during their shift, is going to need to come up here to the daily planner, which looks like a suitcase, has a red cross in it, and they're going to need to click on that. And they're going to need to check their own daily planner as well as their department's daily planner. Okay, your department will either be tech or receptionist or DVM. Tech will be TEC, receptionist REC, DVM DVM. So let's start by having, if Jane was logged in as Jane, her PVL or her daily planner would just open, but she's not. So I'm going to put in Jane's ID up here in the upper left and tab, and now it says Jane. I'm going to go to callbacks, and we don't see that callback there because I scheduled it for tomorrow. So I'm going to change the date range to the 25th. Now there it is. So when Jane comes in, she's going to see that callback. She's going to double click on it. She's going to click on pending, and she's going to read it. Mr. O'Leary called and wants to know what is the name of the groomer you recommended. From there, Jane could simply put in her staff ID, call the client, and leave a message that client was called. Okay, and then change the pending to completed. But we're going to make this a little more difficult. Let's say Jane gets this message and goes, it wasn't me this client talked to, it was Daisy. At that point, she could put a note in there. It was not me the client spoke to. It was Daisy. Or I think it was Daisy. I think it was Daisy. Now, remember when you're making notes in here, always keep this professional. It is always possible these could be printed or the client could see them or another hospital could see them. So whatever notes we make, we want to make sure they're kept professional. And I'm going to click OK. But now we need this to show for Daisy. But all we have to do for that is come back here to Staff ID and change this to Daisy. And Daisy is 190. So I can double click on her and click OK. Now, if you notice, we're looking at Jane Ziola's callbacks, and that callback is now gone. It has been moved. If we type in 190 for Daisy, there is the callback. It has been moved to her. So when Daisy comes in, first she's going to check her tech, TEC, and see if she has anything to handle as a technician. And then she's going to type her personal, 190. And there it is. Now let's go ahead and get in here. And Daisy gets in here and she goes, wait a minute. I think, and Daisy goes, no, it wasn't me. Staff 190 for Daisy. So she types a note. It was not, or I did not speak to this client about a groomer either. Can everyone ask around and see who did? And then what we're going to do is we're going to send this to tech. And I don't need to look it up. We can TEC, tab, OK. So now the next time any technician comes to work and they go to check TEC, because that's what they're supposed to do now, they're going to find this. And whoever it is. So let's just pretend it's me. And I come in and Bill looks at it and goes, oh, I know who this is. Yeah, I spoke to her. So then I call the client and let the client know which the groomer is, and then I put a note in here. Called owner, or called client. I like client more than owner. Client, and told them I use Petco Porter Ranch. Ask for Kaylee. Okay, I change my pending to completed, and I go OK. Click OK. It is gone. It is no longer in the tech reminders. If I close this, come down here, and I can see now here in the summary of Heidi test 5, excuse me, you can see quite a few callbacks because I've been practicing, but you can see a callback there. Click on the different ones, and you can see all our notes that we just made. Okay? Now, let's give a different scenario. We want to send a message to Danny that the washer is broken. That has nothing to do with any of the patients in this hospital. But we could go to patient number 1, tab, use either dog or cat, it does not matter. Right click, click update, callbacks. You can see I have several callbacks in here. I should have deleted these first, but that's okay. We're going to make a new one. See back for Danny, and we want him to look at this tomorrow when he gets to work. We go open, number 9. Excuse me, that's my ID, not Danny's. Tab, change this to pending, and washing machine is making a weird noise. Please check it. Always remember, more information the better on these notes. Who, what, when, where, why. Okay. Click OK. And we click OK again. When Danny comes in and he goes to the suitcase, the daily planner, and he clicks on it, and he goes to his callbacks. Okay, but this will be for tomorrow. There will be a callback there for him. Hopefully it's this top one. He'll open it. Washing machine is making a weird noise. What other callbacks does Danny have? Let's open this one. Danny, do not buy the employees lunch until they know all how to use the callback feature in Cornerstone. That's good information. What else? Danny, do not buy the employees any more food until everyone knows how to use the patient callback feature. Once they've all demonstrated how they know how to use it, then you can buy lunch. Good to know. Okay, so I'm going to come in here and put in my staff ID and tab and mark this as completed. Oh, it wants a note. Okay. No problem. I got to pretend I'm Danny. No problem, Bill. I will not buy lunch for anyone until they have all completed the training. Then we click OK. So there is a little demonstration on how to use the callback feature. I hope it was useful, and I hope you learned from it. Thank you.